what kind of feeling do you get from people on the federal level about states wanting to do this kind of thing?
I think they want, it's just, look, they want the state to do it. Let me be really clear. They'd rather have the states do it than be responsible for it themselves, because they'll get a cookie cutter circumstance. I talked to the folks up there at CMS, Centers for Medicaid and Medicare Services, and again, accessing the federal government is not all that easy. And will they call us and ask us what should be done in Texas as opposed to making a decision without input? And that, I'm really concerned about that. It doesn't matter who's president, who's the Secretary of Health and Human, it doesn't matter who it is. It's just a different structure than the way we do things.
And I would agree with that. I think the federal government has its hands full with many, many things, and I don't think this is really an area that they want to get into. I think they want to see the states succeed in this regard in terms of, running the exchange, and yeah, there are a variety of federal requirements there that are defined and would have to be met. But again, an exchange in and of itself is not a new idea. We have stock exchanges, we have cattle exchanges. We have all kinds of things that are bought and sold in the form of an exchange out there. It's new to healthcare, and it comes with a healthcare reform bill that was frankly very contentious. There was a lot of very spirited debate around it and so forth. And so that connection between healthcare reform and exchange is sometimes considered to be synonymous. The reality is healthcare exchanges have been around for quite a long time in different states. New to the state of Texas, but certainly not anything that in and of itself is unique to healthcare reform. It's just a way, as Chairman Coleman has put it, for people to come and become educated about what health insurance is, and then to make an educated decision on the purchase of health care. And that is something that we really need to be brought to the health insurance market and the health market in general, because I think that's one of the things that will drive some control of the costs.
That gets to the place where, people say they aren't responsible for their own health care because they haven't really chosen it, and they don't see themselves as paying for it. This makes them a participant in the market and the decision making on their own health care and the coverage that they get, and that's the way it should be.
How could this, financially help us when we're in such a big crisis right now statewide?
The health insurance exchange, well, I think what it does is it brings us to a place where people can come to look to buy their health insurance and so forth. The question might come in is how does the health insurance exchange potentially play out in terms of identifying our Medicaid recipients and so forth, and I think the health insurance exchange can help coordinate a great deal of that. There's people that will qualify for Medicaid, there will be people that qualify for the CHIP program, maybe there's those that would qualify for Healthy Texas, a not so well known product out there that was passed the last legislative session. And then there's going to be those that if the health care reform bill stands, there will be a variety of subsidies that would be provided to people. That all needs to be ferreted out somewhere so that people get, as the chairman said, connected to the right type of a health plan out there that meets their needs. Anytime I think you bring the individual in and allow them to be an informed shopper of anything, just happens to be healthcare in this circumstance, you're going to see, a reduction in the overall cost of that particular product or service.
Any idea how much we're talking?
No, I really couldn't give you that idea. I think that we've accepted the fact that we need to create an infrastructure around there, and we need to create a competitive marketplace for this particular product out there, if you will, and then let the marketplace do what the marketplace does well, and that is, competitors work, to try to create the best product out there, and those that can do it at the most cost-effective price are the ones that win.
Remember this, if you don't know what your choices are, you might choose the wrong thing and it costs more. When everything is in front of everybody at the same time and it guides you to the right choices, that makes the market more competitive immediately because everybody says, uh-oh, now there's somebody who's telling them the difference between all these plans, and they say, oh, this one really works for me and it's less expensive, and then the other person has to drop their price. So that's how it really works to save money out in the marketplace. Because it's right, it's a market-based system.
And I think if we look at, you know, it's not, I don't know that we're paying less for electricity, but if we look at the deregulation of electricity 10 years ago or so, whatever it was, I didn't know anything about buying electricity. You know, I knew if the lights didn't come on when I flipped the switch, I checked the circuit breaker, and the next call was to Reliant to say, hey, I don't have any electricity out here, you know. But I became fairly educated on what, you know, it took to competitively buy electricity. And so I understand how it was being measured. I understand what the different plans were. And based on my level of risk, I chose a particular plan, you know. Being somewhat risk-averse guy, I took the plan that it guaranteed the rate for 12 months, you know. There are others who would be willing to say, well, I think the price of fuel is going to go up and down here, and I think my electricity rates could go down month to month, you know, so I'm going to choose to do this one over here. And that's the kind of thing that I think we need to get people informed, and that's what that deregulation of electricity did. People got educated and informed how to buy electricity, and I think that's what we want people to do in terms of healthcare and healthcare insurance, is to create a vocabulary around it, create transparency and simplicity, and let the market do what the market does best, and to create that competitive environment out there to help, you know, really kind of rein in what are some of these skyrocketing costs.
This was done with the Medicare prescription drug program, where either a person and/or a computer was used to help seniors find the best prescription drug provider that fit their needs as well as their pocketbook. So these are really good things, and technology has helped us quite a bit, quite a bit.
Is there anyone that would be left out in a program like this?
Well, you know, the intent, at least with the exchange, is that, of course, with healthcare reform, there's a huge number of people that are thrown into the system. Now, Texas has a large number of uninsured. That's not anything to be proud of. We need to do something about that. And we need to create an effort that brings people into some type of system that gives them some sense of financial security, so that they don't end up in dire straits related to the finances associated with a healthcare problem and something like that. So, you know, it's something that I think will bring, you know, the opportunity for people to enter into the healthcare system in an informed and educated way.
Who would regulate something like this in Texas?
Well, we both have produced bills on that. You know, the particular bill that I've brought forth is one that would create a new, what I call quasi-governmental organization, create a new board, and this would function semi-independently with legislative oversight, of course. And Health and Human Services would be a resource to this group, as would be the Texas Department of Insurance. But it would be a strong public-private partnership, you know, leveraging our private healthcare industry out there in terms of trying to bring the products to the market that would best meet the needs of individuals out there. But it would be, again, one of these type of organizations that run somewhat separate from the government itself. It wouldn't be a new agency or anything, but its sole focus would be making sure that the health exchange functions in a way to bring products to the market that meet the needs of Texans from a whole variety of different circumstances.